be to refer them for care. But if they were waiting 5 years, they may not get back for that GYN exam. And that's why I think a total yearly evaluation is so important for women to have.
Sure. And I'd just like to remind our audience to please chat with us. We'd love to hear any of your concerns or any questions you might have for Dr. Eugene Albright from Riverside, California. And, Doc, I've already have one question coming in from Phil from Maryland. And he was saying that, and I'm sure most people think this, or particularly this may be a guy thing, but he was saying that his biggest fear is going to the dentist is what is this going to cost? And I guess conversely, that may be the same thing that occurs in the minds of some of your patients. What's it going to cost? Have you run into that? People just saying, look, Doc, I'd love to come, but it costs me too much.
Well, yeah, we hear that frequently. However, the cost of an exam versus the cost of your life is something that they should consider.
Sure.
Cost in healthcare is always an issue, but you just have to realize that you're betting with your life on this. You may not get an extra dozen eggs or some milk at the store, but letting your health go unchecked, it costs you the ultimate price. So I think, and then once you get disease, then it costs you everything. So it would behoove women and men to get frequent checkups because, like I said, there's no cost more dearly than your life.
Wow, you're absolutely right. And I certainly hope everyone in the sound of your voice is taking that very serious.
Mm-hmm.
Dr. Albright, what are the leading health challenges for women that you've found in, I guess, the last 5 to 10 years?
Well, clearly, it has changed over the years, and that's a good question, because heart disease, lung cancer are skyrocketing, and breast cancer are skyrocketing in women. Women are smoking more now. They're vaping, they're smoking marijuana. They're just smoking a lot more than before, so that the lungs and the heart disease kills more women than anything. Wow. So the American Heart Association, you're talking about those walks and all that, breast cancer walks, American Heart Association, heart, lung, and then the female issues are all very prevalent in women and rising. So it really behooves women to get that exam, because while they're there, if they have issues about, I got chest pain, or I feel a lump in my breast, or, my periods are really heavy now, heavier than usual, then they have an opportunity to have those things evaluated. And like I said earlier, that could save your life.
And, you mentioned vaping, and that, of course, has really made a big impact on America. There was that myth that vaping was okay, that it wasn't tobacco per se. It was, and I had heard this on television and the radio and other places. What is the real story with vaping?
Well, another good question. And what's happening is the vaping industry targeted children. So wow. That's one of the major issues with the new flavors. They got all kind of candy flavored vaping. And the real danger behind vaping is that you don't know what you're vaping. And that has been a series of deaths and lung problems, because the things that these kids are vaping are black market or off market. And so they don't know what they're vaping, and they're getting a lot of respiratory issues, including death from vaping. And we don't know what they're vaping. So, and it's so new that there haven't been adequate testing. So when you pick up something and vape, you have no idea what you're putting in your system. And as I just said, it's costing some of the kids their lives.
Is that from the potential for cancer, lung cancer, or has it created any other deadly reactions that are not being reported?
Well, that's what's happening now. They're just realizing that around the country, kids are showing up in emergency rooms with illnesses and issues that we're not familiar with. And it's due to this vaping, because when you put these particulate matters in your lungs, we have no idea, because vaping is not regulated or anything. We have no idea what they're smoking or what they're inhaling, and it is affecting their lungs. And so the cases are mounting and mounting and mounting, and it's a fad that's running through these young people's social lives, and it's creating some real problems, and it's going to get worse.
Wow. Now, when you talked earlier about some of the challenges facing women today, heart disease and other things. Now, are there higher incidents as you start to really drill down to the various ethnicities in the country? For example, do you find there's more heart disease among African American ladies than Caucasian ladies, or you find more heart disease in the middle part of the country versus the south? What are you finding as you're moving in your circles?
Well, again, excellent questions. Almost universally, African American women are leading the charge in healthcare issues. Number one is access. And when you start talking about ethnicity, then access becomes a major issue. The women that don't have any health care insurance, women who do have it, that are so busy with their lives that they don't take time out. They're busy taking care of everybody in the family, and they're the last ones to get a checkup or to be evaluated. So that's an issue that we've been fighting as long as organized medicine has been around. We also even find that in certain cancers, a white woman will get one therapy and a black woman with the same issue will get another therapy, and you can just imagine which therapy is more effective.
So can you give me an example of that?
Sure. I'm giving, like, for instance, like, say a woman will have a small cell, old cell carcinoma of the lung. Well, if she's in Hyde Park, she'll get one therapy. If she's in Macon, Georgia, out in a little small hospital, she'll get a totally different therapy. Well, the cure rate of the one in Hyde Park is going to be high, as opposed to a much lower success rate in the woman down in Georgia, out in the rural Georgia. So we have, and now the medicine, the information is the same, but because of cost and all the things you talked about, access to medical care, there's a very clear line that African Americans, sometimes Hispanics, get a different brand of care than our white counterparts, especially if they're elite.
And is that, again, part of the access issue, or are we dealing with folks who are practicing medicines don't quite have the skill level of certain parts of the country?
Well, you're looking at both. You're looking at both.
Wow.
You're looking at both.
Wow.
But access is probably the number one problem in the country in terms of healthcare.
Wow. And I guess I'm going to move to another subject that can be touchy sometimes, Dr. Albright, and that is teenage pregnancy and just pregnancies in general. When you are talking with the young ladies, and let me put a question in before I ask this one about pregnancy. At what age do you recommend that young ladies start to see a GYN, an OBGYN rather?
That's another excellent question, because what we're seeing now is, Mike, when you and I were teenagers, sexual intercourse started maybe in the late teens, early 20s, like that. Now we're getting kids 12 years old who are actively participating in sexual activity, multiple partners. the whole thing as adolescents. And pediatricians generally do not do pelvic exams. They don't do birth control pills on kids. So there's a big uh, issue in terms of who should be seeing these girls. And the way it is now, they stay with the pediatricians mostly, so they don't get any kind of GYN services unless the mother is savvy enough to realize what's going on and bring them in. And then there's the embarrassment and stigma of a kid, being active at 12. So it's really a very big tragedy. STDs and everything that are going untreated because these kids are being improperly, managed. And the problem, one of the major problems is parents. It's difficult because women, mothers, fathers don't want to hear about, in the sixth grade classroom about sexual activity. They don't want us going in there talking to these kids about that. They think that that's going to stimulate them to be sexually active. And what we're telling them is they're already sexually active, and you're missing the boat because of stigmas and because of old time, beliefs, but they're not current in terms of what ages these kids are being sexually active.
And that's a great point, Doc. And I have a question from Gina from Atlanta, and her question is this a new specialty that I'm hearing, pediatric gynecology? Can you speak on that, Doc?
Yeah, it's not a new specialty, and it's not a specialty at all. It probably should be, because the social media and what these kids are dealing with today, listen to their music, listen to what the sexting and the kind of things that are going on at much earlier ages than their parents are realizing, so that there's a whole new groundswell of activity that parents aren't aware of. And, we see them in the emergency rooms but we're not seeing, very, very rarely do I get a mother bringing her daughter in that says, she's 12, she's 13, she's sexually active. What do we need to do? Usually we don't get them until they're already pregnant or something has happened. They got a bad STD or something. So there is not a new specialty about pediatric or adolescent gynecology. There are some doctors who are interested, and their focus is on adolescent medicine, but they're few and far between, and there's not a lot of information for the general public on teens and early adolescence and sexual behavior.
Well, that's fascinating, and I'm surprised that no one has really taken the bull by the horn on that particular subject and tried to make that a specialty, because from what I'm hearing from you, it sounds like that's something that's long overdue.
I tell you, if you want to get a really good fight, start talking to moms about kids having sex.
Oh yeah.
And how you want to bring it into the schools and start teaching it in elementary school and all that. And you will get your nose bloodied very quickly, my friend.
Oh, absolutely. And it's unfortunate that you can't have these types of very appropriate and candid conversations, because I agree with you, and I've actually run into a young couple. He was 12, she was 13, and they had a 7-month-old child. And so you're right. It's happening. There's, you can pick up your phone now and go to 1-800-OO-BABY, and there it is, or whatever, thing your young person has been exposed to. And now they're learning from some sexting site, as opposed to hearing some very candid and well thought out information provided by mom and dad to hopefully keep them from making mistakes, or, as you said, getting them into a medical dilemma that they may not be able to get out of.